A new service at COMCARE called Transitional Care Management is already showing great results. Hi, I'm Barb Gack, a nurse practitioner at Salina Regional Health Center.
Well, Barb, thank you so much for being on the show. I wanted to have you on because of a new service that's being offered, I believe, for COMCARE patients from Salina Regional Health Center. Why don't you explain what we're talking about here?
Thanks a lot, Mike, for inviting me here. Salina Regional has started something called Transitional Care Management, and I am going into the home of a patient that's been discharged from Salina Regional that's a COMCARE patient. So these patients are higher risk, and our goal is to keep them in their home, not returning to the hospital, not returning to the emergency room. That's where people want to be. They're going back to their home, it's their safe place, and that's where they want to stay. So things that we can do in transitional care, and I work in collaboration with their primary care, typically I get there to their home sooner than they can get in to be seen. I'm trying to get to see them within 24 to 48 hours. So in their home, you see things sometime that they don't necessarily, the primary care doesn't necessarily see when they go into the physician's office.
And I know we've looked and we're already seeing some good results.
Yes.
Some data's come in on
Yes.
there. So why don't you talk about that and maybe some of the experiences that you've had.
Okay, so people have, when I see them, I ask them if they have anything that they are worried about, concerned about, especially in the transition before they go from my visit to their primary care, which is typically within a week. They can call me directly. I have my phone on, so hopefully we can problem solve some of that. One instance comes to mind. Somebody was on a warfarin, and the INR was very prolonged, which means that their blood was very, very thin. I said, show me what you're doing. How are you taking these? Well, she'd mixed up the instructions. So that was one experience. Another one was, got to the home and the saturations were in the mid-80s, and that's not a good number typically for people. Didn't have the fast-acting inhaler, and the long-acting inhaler and steroid combo was expired. Nebulizer was broken. So we got that stuff fixed that day, and they went in to see their primary care the next day. So those are some of the things that myself, and I have a nurse that helps me quite a bit, Tammy Lust. She does a chronic care program, but so most of these patients can be in a chronic care program too, and so she helps a lot with, so it's a team effort. Right. It's a team effort with the COMCARE providers and myself and Tammy.
Thank you so much.
Thanks, Mike.
For more information, please visit srhc.com, like us on Facebook, follow us on Twitter and Instagram.